Oh, he's not?
No, we're ready to go whenever you are.
And is this
We have
the known group to the world?
This is it.
Well, if you like, I'll go ahead and call the meeting to order. First, public comments. Do we have any public?
I have no comments other than we have a new member, so welcome.
Yeah, introduce Dr. Goff. Welcome to the board.
And let's see, new business. Let's move straight to the funding.
So I sent you all the packets of information on the budget. This is only one of our budgets, okay? This is the Health First Indiana budget. It is required by state statute to be submitted to the state by June 1. They didn't get us a template until about 2.5 weeks ago, so once they got the template, I started putting it together. Our allotment this year is about $2.6 million, and this is all state funds. And what we're really focusing on for 26 is expansion of our MIH program, our Mobile Integrated Health Program, which is going to help supplement our MS issues in the county. We're also going to be expanding our chronic disease management programs. So that's our obesity, diabetes, heart disease, cancer risk, and all that. That's where we put a lot of dollars as well. We're going to have nurses out in the community in our medical trailer, offering free screenings for lipid panels, A1Cs, glucose, a whole mess of.
Are we hiring new nurses, Doug?
We are.
I saw we had 3 in the budget here.
We do. We are hiring new nurses, and it's gonna be a lot of part-time nurses because I wanna make sure that we're in the community when the community is able to get to us. You know, not everybody can get to our office from 8, 4 o'clock, you know, in the afternoons.
Sure.
So I wanna make sure we have access at a lot of nights and weekends throughout the year, so that way the public has access to us whenever they're available. And the other thing too, I wanna make sure we're mobile, because not everybody can get to downtown. So I'd like to be able to set up down to like Bethlehem, New Wash, down get up in those far areas with that trailer and just get just as much access as everybody else does. So that's where a lot of our resources are going. The other part of the salary budget is the market adjustments we did last year to make sure we maintain a competent staff. So that's continuing on through 25. I mean, one of the other issues, the significant expense, is we're still dealing with the fact that we have no storage facility for all this equipment that we have, and the EMA has all this equipment. I'm having trouble moving the needle on that, just because the cost of construction is so high right now. So I think we might look at renting next year, and that is an allowable expense in the state. We might have to rent like a storage facility next year.
You were at one time, not because we have a limited amount of time, I understand, but you at one time were talking about the health department, not you, the health department, was talking about purchasing some various places.
Correct.
Did all that come to nothing or to a negative thing, or did we ever, have we got anything in the wind as far as purchasing a facility of anything?
There's general support for the council and the commissioners. The problem I'm running into is if I find a location that is available and we can, you know, we have the dollars to purchase, I can't get all the process done in place where somebody else comes and puts an offer. Because with government, there's so many processes we have to go through. We have to get 2 bid or 2 appraisals done and all this other kind of stuff. So it's more challenging because the market is so readily hot right now.
Volatile.
Yeah, so people are just buying so quickly.
Here's an idea, why don't, I hear about these sort of things privately. Is there anything constitutionally or personally, not personally, but constitutionally that keeps us from, excuse me, I should be talking, is that okay to
No
not?
problem. Go right ahead.
But is there anything that constitutionally keeps us from working with some financial institution, I assume where we have our funds, where we could be pre-approved as if we were private individuals trying to buy a house, so that if one of us, Dr. Goff or Teresa or Denny or I find a place, then we could actually move on it before this problem arises. You could say, I'd like to call a special council meeting, or I'd like to do what is legally appropriate to buy a place and not be left out, because I do agree with what you're saying. Can we not be pre-approved as a group?
Well, they have to float bonds, and my goal is always to find grants and other avenues before we start reaching tax through bonds. So, I think I can get enough grant money to get a building if we want one without having to float bonds, or just avoid any kind of interest-bearing loans or anything, just because of tax base. I mean, if I can avoid it. And I think I can. My problem is one, finding a building that we can get the contract on long enough to go through the process that we have to go through. And the other thing we can do is try and build new, but building new right now is so astronomically expensive right now. It's just over the top. I think it would be wise to wait a while yet and maybe rent a year and kind of see what the market does, that we're not overpaying, for today for 20 years on a bond or something. That's our goal here at the health department, is to always seek out grants and outside funding before we try and get into the tax levels. So, and I think we're still got enough time to make those avenues work. If we can rent, and again, using state funds, we can rent.
That's in here.
Yeah.
I wasn't able to download this on my computer,
Okay.
so I don't know why, it's probably me, but.
So that's one of the bigger expenses. Obviously, personnel is a big one. It's over $1 million in personnel. We're hiring a bunch of people, again, just to get out in the community and make sure our services throughout our community. Supplies, with all the equipment that we're gonna have to buy, the A1C machines, liquid mill machines, and all that good stuff, maintaining that trailer, that's another pretty significant expense. The needles and all that all adds up. Really start focusing on community education. Some of the stuff that we've seen disappear over the years, like I know at one point the hospital used to have a diabetes management class you can go to, but to my understanding that no longer exists. So we've got Purdue coming in there now on Mondays, I believe, Monday evenings, and doing diabetes classes, just nutrition type classes and everything. I really want to ramp that up and make sure that we have that available to the community for free. That's also some of the money we're going to be spending. We really want to make sure we're educating the public on health practices that will improve their health outcomes, short-term and long-term. So we're really trying to get away from reactive medicine to preventive medicine, is what we're trying to do. The other thing, we're going to be spending quite a bit of money in trying to make sure that our maternal child care is improving in our county. I do know that there's access issues for when we're pregnant that are uninsured or underinsured. So we're probably going to do some grant money out to and folks like that to help bolster their ability to make sure that women have access to appropriate prenatal care and also post care. We've already been doing it now. I have an individual that goes to the hospital and teaches new moms and dads about safe sleep practices. After 3 weeks, we're going out to the home, we're checking on mom and dad, see how things are going. Maybe they don't have access to formula if they need it or whatever, and we can make those connections and help them out. We've already been to 2 places where the individuals did not have a safe place for the child to sleep. They had them sitting in the car seat, that's where they were sleeping, as their main place to sleep. So we got them new cribs, got all that taken care of. We had another mother that did not have a car seat, so we got that taken care of. So we're making sure that we're going out after we get home from the hospital to make sure that if there's anything that they need to stabilize where they're at and improve outcomes, we're making sure that we're doing that as well. It's been a lot of money trying to make sure that we bolster that. It's really important that from the very get-go that we provide all that's needed so we have better outcomes, obviously. Some of the other stuff we want to try and get going is more CPR trainings for the community at large. It's $50, $70 to do it privately right now, so maybe we can offset some of those costs. Some more community members trained up on CPR. We do. That's also in here as well. We'll be funding postponed with this to keep it going. The other thing that we might try and get into our school health. We've got a grant right now that's helping us with making sure our nurses are in the schools and helping the schools with whatever they need. So we're definitely going to be spending dollars and hiring people to offset some of the deficiencies that might be happening in the schools as far as the health services and what they can and can't do. Not every school has a nurse in it in any of the school systems. I don't believe so. So my goal is maybe we can offset some of that by providing nurses to help in those schools when needed, and also provide care, you know, as we can, providing clinics or whatever. So again, trying to deal with things that we can deal with on the young side of life, so that way long term we have better outcomes. For tobacco cessation, we're probably buying some nicotine replacement for individuals that can't afford it. You know, vaping, traditional cigarettes is another step we're probably gonna be getting into. But also probably gonna be looking at paying for some CT scans for individuals who have smoked and may not have access to CT scans, or because they're underinsured. Want to make sure that we have individuals, we identify if they have lung cancer, we identify in very, very early stages, obviously. The other thing I want to invest in is there's groups that do mammograms and prostate screenings through those mobile vehicles, and I'm trying to get some down here, but the problem is most of them are in Louisville. They're Louisville-based hospitals, Norton's for instance. Well, because of DOT rules, they can't come across the river. And what I want to try and do is get somebody that can come in here and go to our areas that I know have issues to healthcare, and get out into our rural areas and provide these same screenings. I'm hoping I can get some dollars together to pay somebody to come down from like Indy or IU or some group like that. Again, the DOT issues apparently is a pretty significant barrier, unfortunately. So it's just, I gotta figure out a way to make that work. And it might just be that we're gonna have to spend some dollars to pay somebody in contract and come down here.
It's all the Norton facilities we have now, Brian and all these doctors' offices, maybe we can.
Maybe, it might be, and I'm gonna talk to you, because that might be something to where, you know, maybe we can offset a driver or whatever it is they need to meet the DOT requirements. Maybe we can do that just to offset that cost, and we can just prompt that to get done a little bit quicker. I think eventually they're gonna do it,
Yeah.
but they just require the hospital, there's,
Right, they've got a lot on their plate.
yeah.
You've been talking a lot about, if I may interject.
Yeah, sure.
You've been talking a lot about monies that we're gonna use for various great programs, no argument there. But what about, what's the health department doing to make the community aware of the services the health department is offering? For example, what are we doing in regards to health awareness, conferences, or it's the wrong term, conferences or health awareness meetings, like at public events, like thing we have down here in the fall, what is it, on the river?
Ottawa River.
Yeah, out on the river, or something where the health department can actually have a booth or talk about some of the things that we can offer these people on a more of a one-to-one basis. We could do it in New Washington, we could do it in Jeffersonville or Clarksville or God knows where.
Right.
But if we did that, then wouldn't that obviate the need to maybe have so many private individuals trying to come in on a one-to-one basis? Doug, I mean, don't we need a little more oomph
We
in
do.
the community?
We do, and I'm glad you brought that up, because actually we have in the last couple months, we have stepped up. As a matter of example, Saturday, we had folks down there in Borden, they had some parade down there, so we're down there advertising our services down there. We had an event at I think it was the Excel Center on Saturday, we had a group. We also had a group, driving baby shower over here at the Cassidy facility. That was a major event that we were involved with, actually. So yeah, we have done a lot to engage, and that's what a lot of these part-time nurses and staff are gonna be doing. They're gonna be out in the community, just doing the mobile unit, but are also gonna be responsible for being at these festivals, these fairs, these events. You know, we got on the river, we can be. We're gonna make the Strawberry Festival down in Borden this weekend. We're gonna have A1C's being done down there, glucose is being done, lipid panels being done. Now, we have to make sure that we don't do the glucose after somebody eats a strawberry shortcake, but they will be down there offering those services for free. So we are ramping that up now. Just next year, I really want to have multiple teams that we can have about weeknights and weekends.
This one goes along with that, but how are we, advertising this enough, do you think, that we do all this? Because if I just go talk to Joe on the street, they don't even know that the health department offers all this. I mean, we've got a sign out here.
Yeah.
You know,
little
think
mini
kinda we need
presentation
to-
would be
I
good.
mean, I don't know that that's, I should
It's
just
in-
talk about it. Okay.
I have an advertising budget in there.
Well, I'm sorry, I didn't.
It's fine, it's $30,000, and
Okay.
we have done billboards in the past, but I agree with you, we need to be doing more as far as being out there. But these are relatively new programs, so I don't wanna get us underwater and then have the public have a negative impression in case we should get overwhelmed. So it's a slow build, but definitely next year, we're gonna be advertising a lot, and probably even towards the end of this year.
If that's fine.
Oh, you're fine. No, I totally agree, we need to make sure the community is aware of all the wonderful services that we're trying to provide. We wanna make sure that we're spending all these dollars to make this happen. Because otherwise, if we're not doing that, then we need to move those dollars for us. Those are really the big ticket items. I mean, there's some other stuff in here like, cleaning the building, electric and all that, because we're extending our hours and all that, we're gonna have increased utility bills. This is we're gonna use this funding to offset.
And the template kind of helped you.
Yes.
Okay. All right.
What is the difference between our health budget and this program?
This budget is 2.6, and our main budget, our 1159 budget, is typically 1.3.
So you're looking roughly $4 million budget.
And this is from that,
This one is from the state.
but it's from that program that we applied for too.
Yes.
Through all this money. Okay.
That is,
Is it a continuing entity or is this year? Can we depend on this?
so this is, it's tied to the state's biannual budget. So next year, it comes up again, so it could be cut. There's always that risk. So that's why any of the services I'm providing in here, I wanna make sure that, if I have to cut utility bills and stuff like that, and go back to the other services, all these critical services going, that's what this budget's designed to do. So while we have the money we have today, that's great, but I'm also thinking the future should be cut a little bit. I already know what we're gonna cut and where we can make that back up on the other side, so we're still doing these great services. But to your point too, we also have all these other grants as well, so our budget will probably over.
Yeah, just one thing, I heard you're doing a lot. I mean, this is quite expansive. This is tremendous, no argument. But, do you need, in terms of some oversight, which we're burdened with in the county right now, not here, hopefully. But do you need some ad hoc committees or some people, like with the expression of the health department's functions in the county, that you would head, of course, but some groups of people in the health department or otherwise in the health board that could help you approach some of this? I mean, because this is a terrible. This, I don't say 24 hour a day job.
It is for him.
Don't say you need to do it.
It's pretty expensive. It's pretty expensive. So I'm glad you bring that up. So, the state law requires us to come up, we already have our core services for the state. Those core services, we have to have key performance indicators, KPIs. We have to develop our own. They're due December at the end of this year. Those KPIs, we have to go through and identify, okay, these are the things that we know are. So that way, we need to track that, and the performance that we're doing, we need to show results. So we have a community action team that's well over 20 different community organizations. It's family health, it's all these other groups. They meet monthly with Dr. Yazel. That's the group we kind of draw off of what the needs are of the community. So that's kind of where our data-driven information is coming from. Is that what they need. But I am probably going to have some subcommittees just to kind of say, what do we want to do about this problem? Like one of the things we're talking about doing now is helping to provide school lessons to individuals who can't afford it. The YMCA offers that, even at the YMCA pricing for individuals that at a poverty level. Sometimes that's still even a barrier. So we're looking at options to see how we can support that and make sure individuals can, because we've had drownings in the past, and they don't have to happen. Swimming should just be something that every child has an opportunity. because it's such a safety thing. You never know when that child's gonna be hanging out with friends or whatever, and friends got a pool, they don't know how to swim. I just think that, you know, that's something we need to look at. We had a near drowning at the harbors, not that long ago. It's just, I think that's something we need to be looking at. Other things that other health departments are doing, they're looking at buying bicycle helmets for individuals that can't afford them, because obviously head trauma is a significant issue. And now I'm looking at that as well. Gun locks, that's another thing we're looking at, providing individuals that can't afford those. Gun safety is certainly a priority, so we'll make sure that we're addressing that the best way we can, the health department. Trying to think, really the main focus of our dollars right now is more of a clinical presentation than the health departments have done in the past. Because we've always been pretty solid on immunizations and, you know, the environmental side of everything and all that. We've always been pretty good. But we've never really gotten into this whole preventative medicine, dealing with obesity, dealing with, you know, heart disease, dealing with cancer. This is very new for us, so it's gonna take a minute to figure out where we're at and then figure out what's the best course to make improvements that we need to be doing. So that's where the majority of these dollars are gonna go. It's more on that preventative health side of things.
Do you find that's true of other health departments around the state or across the river? Are they doing more of that type of thing? In other words, are they into more preventative health care? Have you got a feeling from, say, Jefferson County, Kentucky, that they're, of course, much bigger health department, I would assume, bigger area.
They are.
But, are they doing those kinds of things? Have they geared into that sort of thing? I applaud that idea, but,
Right. I really don't know so much what Jefferson County is getting into, but I do know that the counties in Indiana, because if you took these dollars, you're required to do a lot of these types of interventions. So we're all kind of doing this together. You know, like Fort Wayne, Allen County, they've already had programs like this, but they're a very significant county. They're much larger than us. Their budgets are bigger than ours. But so I talk to those folks to find out, you know, what they're doing, try to figure out what is working in other counties. We're not just starting, you know, going down the wrong path. So we're definitely trying to figure out ways to maximize the dollars, maximize the benefit, and get the most efficiency out of what we're doing. But yes, you're right. You're right. They have to do it. If they've taken this money, they're required to do some missions. They're very free to do how they want to do it. They can take any path to the same goal, but they have to have what it is required.
Let me go back to one thing.
Yeah.
I'm trying to think how to say this, but Charlie brought it up, talking about using the resources that we now have, and talking about the board people. You've got an awful lot of expertise in different areas within people on the board and other people that we know outside of the board that would like to participate and help. Don't hesitate in using them. Yeah, really need to.
Right. Well, and again, as we start to develop our own county KPIs and our staff, we're gonna start bringing in these community professionals, figuring out, okay, this is our baseline data. This is, you know, based on state averages, we're below, we need to figure out how we can improve these things. That's when I bring in folks like, you know, Norton's, the cancer group, you know, lung disease in Clark County is high. So how are we gonna address lung disease? Prostate cancer may be another issue. Maybe it's just one particular, you know, ethnicity that has cancers are higher than another. So how do we get into that group to figure out how we can help them? That's the kind of things that we're trying to do. I'm not gonna try to do this all. There's no way. But I wanna make sure that it's fact-based, data-driven, and we can provide results. I wanna be able to show this is today, this is an improvement we have for tomorrow. But that's the majority of the budget, and equipment is another thing. Most of the equipment that we're gonna be buying it's really kind of preparedness type stuff. We need to buy new radios, 800 megahertz radios. So we're out there on the hazmat responses. We're out there doing community vaccine clinics. We're trying to communicate with each other. We're trying to reach back and forth the central alarm. We need to start replacing radios and propping that. Generators, that's another thing I want to try and get a little more robust on. This office has a generator on here, but it doesn't. So that light bill, if we lost power, a substantial bill, it's still be up. Has to help. So we buy equipment to kind of make that happen.
Seems like they did an awful lot for $260,000.
2 million, 2 million, yeah.
2 million.
Well, and we can't because we have all these other grants that we're maintaining now, so we have a lot more flexibility in how we can stay in the cost. So now those grants dry up. So and again, I'm always kind of thinking, okay, if it dries up, where are we gonna pull from?
I get into reminiscing here, but the health department used to be pretty much strictly reactive.
Yeah.
You know, back in the 70s and 80s, the health department was reactive. We reacted, well, I wasn't part of it, the health department reacted to what happened in the county. It was a reaction process. Now it seems like with all the county bill and the state's funds and all this, they need to get into more of a proactive.
I think too, public awareness.
Right.
People expect something. They are not gonna sit still for a lot of shenanigans. Not very long. I think we're about to see that right now. But, I think if we're gonna do this, that's probably what we ought to be doing.
We said we were gonna do this, that's what we ought to be doing.
I mean, time and again, we've looked at this and we know, you know, somebody having to have a heart surgery is kind of far more expensive than trying to get somebody to get very younger and saying, you know, maybe do this, that kind of thing. So you're right. In my time here, I've seen it flip how health are having that. Now we're trying to move towards, you know, proactive approach. But I also have to maintain a balance, so there's certain things we just can't control. So some things are gonna be reactive, so, but I think it's the right concept to go this route, but I think it's gonna require patience as we try and change, not only just within the health department, how we've always been, but how we interact with the public, to make sure that we all know that we're going from this reactive group to more of a group that's working together and figure out how we can all get to the same place we're all trying to get to, just have normal lives. So, so that's kind of the goal, is just to make sure that the place that we live in is safe, access to medical, and just, you know, a place where you want to live, raise your family, that type of thing.
One question, Doug, I know you're doing all this, and I saw on the budget thing, a budget for the assistant administrator, I believe. And who is the assistant administrator?
The assistant administrator is, right now, it's those two.
Mainly her.
Yeah, there you go. Found out.
Yeah.
Well, anyway, so they are working with you every day and forming policy and implementing policy for the health. That is correct, is that correct?
Not so much policy, so much as it's just the way they, you know, the finances. These kinds of dollars, I need to make sure that there's multiple people, you know, looking at everything we're doing and this. That's why we have all these internal controls. So that's their role. Dr. Yates and I, we work with our community partners. That's kind of that information's coming from.
Right. I just thought somebody could help you carry the load in an administrative way. That's the whole idea. I didn't realize you had them right here, right?
Yeah.
So,
He
Well,
does most of it. He does most of it.
well, no, I mean, I think everybody needs help.
yeah. I mean, they, you know, when I'm here on the weekends, doing budgets, they're here on budgets and.
Sure.
So, you know, I mean, it's a lot of work, you know, but I do think we're doing a lot of good things, so.
I agree.
Any more questions? So the next process of this is I got sent to the state by June 1. And then the county, auditor's office just sent last night the information for the county budgets. So this also has to go to the county council as well. So the state will be on one track of approval, and then the county will be on another track. And at some point later in the year, there'll be a reconciliation. So we'll have to go back. And speaking of the budgets, they just sent the email out yesterday, and it sounds like they're gonna be due on June 14th. So I have to get about, 16 or 17 budgets together, now that we have the funds to do this. So we're gonna have another meeting before the 14th. So if you wanna approve this, and then move on to, identifying another meeting date after that.
Before we start, do you anticipate the price of changing any of this? I mean, it's,
I wouldn't think so, because most everything in here is, it's all related to what we're already doing today. And as the programs I've laid out, I don't know that anybody would argue with the health department screenings for,
right, if the money's there, they
diseases.
should.
And these are state funds. This is not tied to local. This is a state fund. Yeah.
I can meet again before. It's not the week. It's
Do you wanna,
17th to 21st. That's
I
that.
personally, I think we ought to go ahead and approve what we've got here and get that out of the way.
I agree with that.
And,
Good idea.
take that, set a date for when we're getting back together.
You got a date you want us to get back
or
together?
you wanna do the approval first for this?
Yeah,
I move we approve the budget as,
have a motion,
I move that we approve the budget as written.
all right. Have a second, any discussion? Hearing none, call for the vote, all those in favor signify by saying aye. Opposed likewise. Passes.
And meeting dates. So, it's gonna have to be after that first week of June, it's just gonna have to be that second week.
You go.
That's what I'm looking at. Yeah, it's gonna have to be, if we can, like the 12th of June. That Wednesday.
Good with that.
You
12th.
folks okay, Charlie?
Yes. I don't know, I mean, I'll be here, I guess.
Do you wanna do 8:30 then, is that, go back to the regular schedule?
That's the length of the, I gotta tell you,
One question, Doug, I mean, I don't mean to, this is so naive of me, I just don't know anything. But, how does our budget in Clark County, the other budget, integrate with this, or dovetail with this thing?
So the 1159 budget goes into this because market adjustments are all done in this fund. So 1159 is kind of like the base budget. This is the, this is what makes us able to do all the additional programs. Yeah.
And how many counties didn't go along with this program?
There's 4 or 5. So that's a good point. This could change a little bit. So if these other counties again opt out, then this budget will increase again this year. If they opt out, if they opt in, then we're good. It's set. This is our base.
Oh, get off out.
Yeah, I don't know. I'll be honest with you. Here's what I've talked about before. If you're a relatively small health department, you end up with these kinds of dollars with this round of funding. It sounds great, but it's a lot. And I can testify it's a lot. And some health departments may only have 2 or 3.
They can't do it.
It's just, it would be
Overwhelming.
overwhelming. They would need time to flex into it more so than we did. So to be fair, I do think that it sounds great when the money's coming in there, but there is that, it's a huge responsibility. So there's a lot of,
And a smaller, need to do it.
and they do, and they, you know, the smaller counties, I think, struggle with it just simply because they don't have a hospital we have. They don't have 2 fairly qualified health centers that I can reach out to and say, hey, you know, we've identified this as a problem in our community. Can we partner to make this work? They don't have that. And that's why I do think this, if county had opted out, help it is a heavy lift, it really is. And they don't have a base community partnership. I feel wrong.
Do we need to have our attorney here?
Not only this, not just a simple issue, this is, you know, it's no sense.
Is there any, collaboration with other local folks like Floyd County and other things we're doing?
Yep. We have, there's a southern group from the state that we all report to. We have conference calls and, you know, kind of highlight what we're doing.
It'd be a good opportunity to learn.
Absolutely. And, you know, we work with all the surrounding counties. Like if I'm running low on this supplier, that vaccine, whatever, we can borrow with each other. That, so, yeah, we can work well on surrounding. It's definitely a partnership.
Before the meeting ends, we do need to approve the minutes from the previous meeting.
That we cannot do because,
Okay.
Dr. Goff couldn't, because you weren't here for the minutes, and with three, you cannot. So you'll have to wait until we have the other members back to make that.
Okay.
So, this motion passed for the budget.
Yes.
All right, so June, what do you want to do? June 12th, that good? Amber?
Yeah.
Good.
I guess over here.
Faye is only in town 1 week out of the month, right?
She is, and she told me that she'd be available on the 28th, but unfortunately the budgets are due on the 14th, so just calendar wise, that's just doesn't work. But as always, I mean, I always send everything to everybody, whether they're gonna be able to make it or not. So I'll get that together, and then I'll email you guys the budgets once all that's done. Certainly, if you have any questions between now and then, just give me a call. If you want me to do over it, just let me know, just sit down and go over it.
And when will we learn who our other board members are?
Yeah.
So, we submitted the list of names to the commissioners for their appointment. You know, they have a traditional appointment. Yes. And the last I spoke with the commissioner's attorneys, the city of Jeff has not provided a list of 3. So, I'm hoping the commissioners will act on their appointment, because they have that list. And then the city of Jeff, it's just,
I called the mayor,
okay. Okay.
but apparently it's not caused any action.
Again, I've not been told they have that.
Why would, if something as important as the health department, why would they not? I mean, I'm asking the wrong question, I suppose, but why not?
I could speak to that.
Yeah, I know.
Okay. Anything else?
I move we adjourn.
All those in favor? Signify by saying aye.
All right, thank y'all very much.